Hi, Mr. Lindmeier. Pleasure to meet you, and thank you for making time for our program tonight.
Thank you for having me, Vassy.
I wanted to start off and just ask if you are in touch with your colleagues on the ground and what they are telling you right now about the situation there.
So we had some 20 hours or something yesterday where we couldn't get in touch, but from somewhere in the middle of the night until this morning, we then got in touch again. And I actually was in a briefing with them this afternoon to get the latest update directly from the ground from our colleagues in Gaza. And that's really humbling news and humbling stories you hear there. They tell us how it is not only in Al-Shifa hospital, but that's the prominent one now as it is, with the circumstances on the ground, with the many patients, double or triple the bed capacity, with the many people sheltering, thousands of people sheltering in the hospital in Shifa. Not too many, because many have left or tried to leave already. But in some other hospitals, there's literally tens of thousands of people sheltering, trying to find some safe space, all with lack of water, lack of food, lack of sanitary situation, no waste water system, meaning garbage and wastewater just needs to go out the door because nobody there is really stepping out to get the garbage anywhere. So anything like what a hospital should be, a total unsterile, unsafe environment where doctors and nurses and healthcare staff try to do their best with the little means they have, sometimes under the lamp of a mobile phone or of a flashlight, sometimes without anesthetics, sometimes or most often without any bandage material or anything which could make the suffering of the people a little bit lighter.
There's a lot in there. I just want to maybe take it step by step and start off and ask about the situation as it pertains to fuel and water, the ability to basically kind of keep the lights on at Al-Shifa, for example. I saw that the director of the WHO had said it had been a number of days. Yesterday he tweeted it had been a number of days without that. Is that still the case?
It's getting worse because the little fuel they had is also running out. So you cannot think of a full hospital running on a little bit of fuel. So individual units that shut down or were also impacted by war operations. But yes, the fuel is basically running out. And the lights there therefore go off. The instruments are not working. The dialysis apparatuses are not working anymore. Incubators for babies are not functioning more. It's a horrible scenario.
And is there any information that has been relayed to you about the fuel? I'm sure you're familiar now that Israel says they did deliver some fuel, but that Hamas instructed the hospital, for example, not to take the fuel. Is there any clarity that your colleagues are able to offer you on that?
So the colleagues indeed said that the Israeli soldiers placed somewhere in a courtyard 15 jerry cans of fuels. You take that, multiply that by 20 liters, that's about 300 liters of fuel. The hospital on a normal day needs 17,000 liters of fuel. Now you can imagine what that drop in the ocean means. And plus these jerry cans are in the middle of a courtyard where people don't dare go, because in that same courtyard and around the hospital, there are bodies lying around, bodies of people who have been killed, which cannot be taken to a morgue, given a burial, because nobody dares to go out there. Same with getting the garbage or waste outside of the hospital. So yes, indeed, it's cynically true. There has been some fuel delivered. But A, it would not have been enough to more than 15 minutes or 30 minutes of fuel of generator operation. And B, it's very risky and difficult to get to.
So just to sort of expand on that point, if you could, because it's difficult for us to know what is going on in there. Basically, from what you're being told, nobody even feels safe leaving the structure of the hospital. Is that accurate?
That is very accurate. So that's a specific of the Al-Shifa hospital and also of the Al-Quds. Those two hospitals are very much, basically on a military siege right now. Fighting going outside around the hospital. Some reports having had shooting inside the hospital, so targeting the hospital, shooting inside the windows. And that is, of course, the situation where nobody dares going out, which means you basically have the patients, the staff, those who are sheltering, trapped inside the hospital right now.
And is there anything that again is being relayed to you about Hamas's involvement? Because that's of course what we're hearing from the Israeli side, right? That Hamas is underneath the hospital, that also Hamas is preventing even that small amount of fuel, as you mentioned, as you characterized it for us, from getting inside in any way. Is there anything you can relay on that?
So in relation to the fuel, that's not the reports we've had from our staff and from the doctors and the people we've been in touch with. That's rather that nobody dares getting those 15 jerry cans for 30 minutes of generator running, which makes not much sense. On the Hamas operation centers allegedly under the hospital, that's something WHO cannot verify. And it's also not our mandate. It's simply not what we can verify, certainly not from here. But what we can verify is what's above the ground. And above the ground is a once functioning hospital with hundreds and hundreds of patients with wartime injuries, with pre-wartime diseases and injuries, and they need to be taken care of. And neither should a hospital be abused as a military installation. Absolutely not. That's something totally against international humanitarian law. Nor should a hospital or healthcare or doctors or nurses be attacked. That's also absolutely against international humanitarian law.
Is there any conversation that the WHO right now is a part of that is talking about international allies, for example, like the United States, more concretely asserting that? The people who basically have a conversation going on diplomatically, for example, with Israel, or in any really part of that world right now? Like, is there any discussion of kind of staying away from those hospitals?
So since day one, WHO and the whole UN is involved on all levels to discuss, to put diplomatic efforts, also to put pressure. In fact, what we are doing right now here is also a part of that effort, because it needs to show the world what is going on there and not turn a blind eye to these people there just because they may be Palestinians. There are mothers and daughters and sons and fathers who are dying there. Every 10 minutes in Gaza, a child is dying. But at the same time, with all these efforts, we're also calling each time for the absolutely unconditional release of the hostages. Let's not forget that. The attacks were horrible, and the taking of hostages was absolutely horrific and still is. So there are not two sides to medallion here. This is absolutely on the same paper. We're using all our power we have, and that is on the diplomatic side to get the international partners, exactly as you mentioned, Secretary Blinken and other partners, the international community, the conference, which was just recently in Paris, held by President Macron. These are all little baby step successes. But at the end of the day, of course, we hope it leads to a better end. Noting, though, that for many, many people, these baby steps will be very much too little and too slow.
Mr. Lindmeier, I'll leave it there. I appreciate your insights this evening. Thank you very much.
Thank you.